I now have the great privilege of introducing our panel discussion about the Woodhill neighborhood transformation. Now, this next session is a shining example of the power of collaboration partnership that's happening in the Woodhill neighborhood. Our panelists will share exciting plans for the Buckeye Woodhill neighborhood transformation, enabled by a $35 million HUD Choice Grant. Plans include providing high-quality, mixed-income housing, improving employment, income, health, and childhood education for residents. And this is a true model of how to do 21st century urban revitalization. I will introduce our panelists. We're going to be hearing from Ms. Marilyn Burns, a community leader advocate and community resident in the Woodhill neighborhood. Ms. Kimalon Dixon, who's a senior project director and for Cleveland Purpose-Built Communities, which is a partnership of the Cleveland Foundation and St. Luke's Foundation. Also joining us is Jodi Cunningham, who is the Director of Health and Housing for the Community Builders, and we're going to hear more about that. And also Dr. Claude Jones, who's President and Chief Executive Officer for Care Alliance Health Center. So I'm eager to start this conversation. If we could start with Ms. Kimalon Burns. Kimalon, can you please share with us some of the challenges experienced by the Woodhill community, both in the past and in the present, and what the partners who are involved, including the purpose-built communities, in the transformation efforts are hoping to achieve over the next 5 years? Set the stage for us, if you will.
Sure. Well, I want to first begin by thanking our partners and colleagues who are with us today, and thank you for Better Health Partnership for giving us this opportunity to really share the story of Woodhill. Before we can really get into the story of Woodhill, we have to look back in history. And it really touches on what Dr. Boland said around practices and policies that were rooted in racism. Woodhill is a place that was built in 1939. And unfortunately, much of the structure has not changed. But one thing that has remained the same is the people and the heart of the people who live there. They have legacy, they have culture, they have social connections that root them in this place that could be wonderful, but a place that wasn't set up for them to really live in abundance. So the work that we are doing when you talk about transformation is really taking a comprehensive approach around education, health, social services, all those social determinants of health that we know impact the quality of life for people as they live and experience neighborhoods. So some of the practices that Dr. Boland talked about are Woodhill homes are an example of that. Redlining, blockbusting, being prohibited from having access to federal mortgages, which prevented Black people from being able to lift themselves out of concentrated poverty into home ownership. So we see that that's the past of Woodhill, but the future is a collection of partners that are coming together and working with residents, sharing power with residents to really enhance the quality of life there. So you've heard about this awesome opportunity by HUD to activate the Woodhill Transformation Plan that really took over 2 years of a planning effort from community stakeholders, community residents, all coming together to really reimagine what this neighborhood could look like. So now we're at the place that we do have dollars to activate this plan, but moreover, we have a community who's committed to really giving more dollars, leveraging resources so that we can fully activate this plan and set this community up for a better future. I hope that answers your question, Donald.
That was terrific. Thank you. Just another quick follow-up question. Looking at the beautiful painting in your background, I trust you're not here to sell us a bridge. How are you going to make sure that the work that you're doing, the work that that all the partners are doing, are going to ensure that the transformation becomes a mixed income community and doesn't result in displacement from gentrification? Because we've seen that a lot in our community.
Sure. Well, first, our highest level of accountability are to our legacy residents. And our hope and our plans are such that we want to create better living conditions that support and retain our legacy residents, while also providing opportunities to really deconcentrate poverty by attracting new residents. It is not the intention to create conditions for gentrification. We are working with fantastic partners like Burdenville Car Development Corporation, among others, who are doing things to make sure that we can maintain affordability and also do things that are in the best interest of our residents. Secondly, The way that we set up our governance structure, we have more than 100 partners working together. And as I always share, we have to coordinate how we work together and how we work together better. And that's really around developing a collaborative governance structure that integrates residents at every level of power and decision making, so that if we see conditions starting to set up, we can take immediate action by working with our residents to make sure that we are doing things in their best interest. So I think that's the best thing that we can do. And also working with our city officials, our resident stakeholders, our other stakeholders, to make sure that we are doing those things that won't set up conditions for displacement. It is not the goal of this project to displace residents. It is our hope that they want to stay, because we know that social connectivity is a really big part of health and living in a really flourishing way of being in your neighborhood and in your home.
Thank you. I hear in that the importance of the community voice in how you've structured your pretty vast partnership. And I think that's critical to the success of the project. Thank you for that. We'll come back to you with some questions and for some more conversation in a minute. I'd like to turn to Jodi Cunningham. Jodi is the leader of the Community Builders, and I'm hoping that you can explain how the organization, the Community Builders, will what role they will have in the transformation, and how the Community Life program in particular is going to help address many of the needs and disparities highlighted by the Woodhill Community Health Needs Assessment, which this is really founded on. Ms. Cunningham?
Thank you so much for that introduction, and for Kimalon for giving us that overview as well. So I am the Director of Health and Housing for the Community Builders, and we are a fortunate partner on the Woodhill Choice Initiative. We are a mixed income housing developer. So mixed income is exactly what it means. We have residents that pay $0 in rent and on a range up to market rate. And that's really the real experience of choice, and it can really create these mixed income neighborhoods that we know are so important to the growth of our cities. The Community Builders, we are a developer, like I said, but we also have our Community Life Department, which is where I am housed, and we are the people lead on the Woodhill initiative. So what that means is we are helping our partners drive together towards these outcomes that come for us around workforce development, education, civic engagement, community engagement, and health, which is, of course, my favorite because I have a public health background. We are really well positioned to partner on this Woodhill initiative because we were actually one of the first recipients of this Choice Neighborhoods program back in 2010 during the Obama administration with one of our Cincinnati housing sites in the Avondale neighborhood. So we've been through this and we are really excited to bring our learnings to this project as well. So I did want to zoom out a little bit, Donald, for us and just talk a little bit more about the Choice Neighborhood program broadly. So this program is really birthed out of the Hope 6 kind of reinvestment in public housing and switching that public housing to be mixed income housing, which we know makes for richer neighborhoods. So the Choice program leverages significant public and private dollars to support locally driven strategies, which Kimalon just walked us through a little bit. And these are addressing, neighborhoods that need some more support that have traditionally been disinvested in the past. So there may be distressed housing conditions that require a comprehensive approach towards transformation, which the residents and partners have spent a lot of intentional time figuring out. So there are a vast array of stakeholders, local leaders, residents, public housing authorities, like we talked about, cities, school, police, business owners, nonprofits, every sector that are all working together to really invest this $35 million in the most robust way with resident voice at the center.
Wonderful. And at the risk of sounding self-promoting, can you talk a little bit about the partnership with Better Health Pathways Hub and how this might support the approaches that you're taking with the wraparound services, stabilization of housing, workforce development, all things we've heard about so importantly this morning.
Absolutely. So our community life model and what HUD likes to see for this work is that we have case management services right after we get the award, right? We had to have these case management services on site for the residents currently living in the Woodhill neighborhood within 60 days of our award. So it's really quick. So we have trained community life service coordinators that really walk with residents every step of the way, supporting them through relocation, connecting them to all of these great partners, right? We may have all of these partners at the table, but if there's no connector there and there's no real access, then our residents can't take advantage of that. So our trained staff are going to work with residents to develop family success plans and support them with what they say they want help with, right? When we zoom in on the health piece of that, there are two key outcome areas that the Department of Housing really cares about, and it is insurance, making sure folks have health insurance, and primary care connection. So making sure they have a medical home, a primary care doctor that they can go to, which I know you're going to hear a little bit more about that in a minute. But we are really excited about the initiative that we are going to engage in with Better Health Partnership, because we are actually going to become a community organization in the hub model. So we will have our community life service coordinators in our phase 1 go through the training to begin to work in the hub model as extra leverage and resources and these robust connections for our residents. So we will participate in the hub model. I know we're getting ready to train this month in that. The next phase of that, though, that we're also really excited about is that we have an initiative where we are going to bring residents into the fold. So we piloted resident leaders in the initiative I talked about in Cincinnati, and hiring resident leaders through our housing organization to then work with mothers in our community, coach them to adopt healthy behaviors, connect them to resources, et cetera. The next step for us is to pay for them and support them to get training and then eventually find a career path as a community health worker or another entry-level healthcare career, because we know that's a great pathway for a lot of single mothers, which is a lot of our residents that we're working together with. So we are excited to also bring resident leaders into the fold and eventually train them in the hub model so that they can begin to, number one, have a career pathway, and number two, support other residents in the community to make healthier choices.
And I would say that as the Community Pathways Hub model is reimbursed through Medicaid, this is an important piece of the sustainability that I think we're going to talk about more as we continue this conversation. It's really kind of the ideal business model. How do you get paid for work you're already doing? This is one example, and this is a way to pull the community in, not only to address their needs, but to start to develop their own economic independence. It's marvelous. Speaking of health, I will now introduce Dr. Claude Jones. And Dr. Jones is the president and CEO of Care Alliance, one of our critical federally qualified health centers in the Cleveland area. I've seen a map recently of the Woodhill area and how it really sits in what you might almost call a health desert, just as we talk about food deserts. And Jodi just highlighted the importance of establishing insurance for the residents, making sure that people have a patient-centered medical home for their primary care. Dr. Jones, I'd love to hear from you how Care Alliance plans to work their way into this neighborhood, become part of the community, and address these needs for the residents.
Okay, so thanks for having me, and good morning, everyone. So right away, when you're looking at going into a new community, you want to develop a sense of trust so that people understand who you are, what you do. We're beginning to do that now. So our plan overall is to open a clinic on the 3rd floor of the community center. I think this would be a great area for a primary care center, and as you mentioned, a primary care medical home or a patient-centered medical home. So with a patient or a community member, we want to build a team around that person to make sure they don't get lost to care, make sure there's good follow-up, make sure we kind of work on those social determinants of health. This includes a care coordinator, nurse, medical provider, and also a behavioral health specialist, which is also a big part of it. Health and wellness is so important to a community. So the more we can, continue to educate, provide those services, work on those social determinants of health, get individuals signed up for insurance. When we did the needs assessment, 34% of the residents actually went to the emergency room to receive primary care. So we want to jump in right away and make sure individuals know we're there for the community. Well, and what's also very interesting is, and you just mentioned it, being in a medically or designated a medically underserved area when you're only 1.1 miles away from the Cleveland Clinic. So this shows that the more we can do these type of programs, and maybe this is a national model when we're looking at redeveloping a community, bringing along a health and wellness part with it as well.
That's terrific. And maybe you can mention too, are there other ways that you see alliances and partnership with some of the larger health institutions in terms of offering services that the Care Alliance might not be able to provide?
Sure. So right now we're working with the Cleveland Clinic, the Taussig Cancer Center. They come over to our center bi-monthly with their mobile mammogram unit. We're also adding optometry services to our scope of services this year as well. I think the more we continue to work with the larger hospital systems, really understanding that many of these individuals don't have anywhere to go once they leave our facility. So we have MOUs, active MOUs in place with the three large hospital systems right now, so that we can, get our patients over for care. There's good follow-up. We follow them through the system because it can be overwhelming. We look at health literacy for our population as well. So just having that team around them where they can navigate through the system and, they get those services and make sure they follow up with us. So, we're continuing to work on these things and make sure it's pretty seamless for the patient. We still have work to do, but we've come a long ways.
That's terrific. The themes are so clear of partnership and, doing what we're all good at. And this is marvelously promising for the future. I know that Care Alliance is going to be involved in this career development, potentially using the Pathways Hub as a model, developing people into community health workers. Tell us more about your role there.
Yeah, so and you mentioned it earlier, the Pathway Hubs is something we already do and we should do to the best of our ability, but now we're able to get paid for it, right? But it really helps the community because it's linking them to services. Many of these services happen on the hospital side. So again, there has to be great communication, great processes in place so that patients don't get lost. And it's not necessarily about revenue, but it's about the linkage to services and making sure they follow up over a period of time. Because even if you make a referral, if there's not a process in place where you actually follow up with the patient, follow up with the specialist, actually have a conversation with the specialist. I'm an internist. I still see patients. So I still experience some of the pain points I've always had during my whole career. These things are getting better, but if we can share that health information as well, because many patients, they come back from the emergency room, all they have is a discharge summary, and they don't have their medical records. So if I can get on the phone and have a conversation with the specialist and involve the patient at the same time, it knocks down all the barriers.
And I have to say, even within a large health system, as a primary care provider, this is a journey we all have to take together too. We have tremendous resources in our electronic medical record. It's not the same as a conversation. I appreciate your bringing that up. And last but not least, by any means, I will introduce Ms. Marilyn Burns. And Ms. Burns, Ms. Marilyn, as I understand you like to be addressed, can you please tell us about the needs you see in the Woodhill area for the resident healing and also your role in the survival peer network and how this will help to achieve these goals?
You know, I'm glad you called on me last. I really am, Donald, because I've had an opportunity to hear everybody's piece of what they're bringing to the transformation that is about to happen in Woodhill. And let me say, all of these things are very important to what is going to happen here. But what's most important and the most important foundational piece that I have always been preaching since the day when I moved here is the healing of the spirit. Because if we don't, our bodies are the home of our spirit. If we do not start building on that first, and nothing else we do is going to change. I say that because people here are broken. They've lived in historical, generational, intergenerational society traumas for so long that they don't see a way out of any of this. So what we're bringing new to the community is fabulous. But if you don't restore and revitalize a person's spirit, making them feel good about their self, then none of this is going to work. We are so reactive and proactive in what is happening here in our communities that at the 11th hour here now we're asking for help. This should have been generated, which was when we talk about structural racism and all of that. This was intended to be, to break us as a people. So now we've gotten to this point where, six in one hand, half a dozen in another. I really don't care. Whatever they do, they do. But we need to dispel that type of mindset. I walked these grounds for 20 years. Every single day, you'll see me outside in somebody's face and somebody's talking to them every day. You're beautiful. Your walk looks great. You smile and you look this. And they look at me and who is this lady telling me these things? And I know that this is important to them because their mindset and their spirit has been broken for so long. Nobody has ever addressed that. Why don't they go to the doctor? I don't care. Who else cares about me? But we have to change that mindset of people. I don't care. I'm not going to eat right. I'm so I don't care. They have another agenda. And unless we address some of those agendas, stop bringing surveys. Stop asking people, what do you see yourself in 5 years? They can't see their self past today. And if we once start meeting people, really talk about caring, meeting people exactly where they are, no matter where it is, nothing's going to change. One single little word, one hello, I love you. How you doing, my king? How you doing, my prince? And it changes the trajectory of our spirits. We need to work on something first. Our foundation is built on the spirit of people. If you build it, they say, then they will come. If you build a better spirit in me, I'll not only feel better in my mind, I'll treat my body better. I'll do everything better because now I'm involved. I'll care about what's coming. It's like the sunshine after a storm. Don't you feel better? You just go outside, you're just shaking something off of you. And we need to shake some of these disparities, and we need to start with the spirit. I talk about it all the time, and I guess it's kind of hard for people to put a grasp around because they can't see it, but yes, you can. You can see it by the way people dress, by the way they walk, by the way they talk. You can't see the wind, but you know the factors of it when it blows a tree down or you see the leaves on the tree. You can see it. You can document it. In another way that people collect data, well, how are we going to monitor that? How are we going to keep track of that? Start talking to people. Then you'll see the change in the community. Right now, every day that I walk out here, it's very almost 0 to none to have people have a positive attitude about what's happening. They didn't believe it. They still don't believe it until the first phases of this is being built. Okay, I've heard so much negativity around the activities that are going around, but I think And we no longer, Donald, call it food deserts. We call it a food apartheid because it involves so much than just food, housing, literacy. It just, spirit, if you will. I preach spirit to the choir all the time because if you don't feel good, if you don't start working on the spirit of people, treating them like they're human beings, involve them, no matter you look, but one day that shoe might be on your foot. So we have to have respect for each other. We have to bring love back into each other. We have to have a feeling that no matter where you are still an important person. We have to remember that we are all descendants of a king. So that makes us royalty. And we need to remind each other of this, no matter what factor of life that you've come from. Always remember up today, down tomorrow, you know? So we need to remember that to respect each other as human beings. Yes, this has been like this, red line, it's still being red line, only a different face. And because we come here and talk to these people, because we know their educational and literacy background is small. So I always say, meet people where they're at. You know, a lot of people here don't have PhDs. Heck, a lot of them haven't even finished school at any type of level. So they're intimidated when organizations come here and ask them these questions, they back away and then they build in a stronger wall to keep you out. Trust. Oh my God. I preach this every day in every room. Trust is, I've been here 20 years. I'm still building trust in my community, but I've come a long way from where I am. So when I talk to people here and win their confidence, it's because I'm out here every day with them. I don't care what you look like. I don't care if you haven't had a bath today. I don't care about none of that. What I care about is how you feel inside about yourself. And if we start on those levels of dealing with people, they'll start feeling better about their self. They'll start being proactive in what's happening in their life. We got to start from the spirit first.
You have a powerful message and you are a powerful speaker. And you make me think that, I drive through Woodhill to get to work. I need to find a way to stop and to say hello to the community myself. I think we have an obligation as a larger community to all learn what you just told us. You described a lot of trauma. Can you talk about the Survival Peer Network and how that fits into the message that you're bringing and the work that you're doing?
First of all, yeah, I see a lot of trauma, and a lot, and I'm very transparent because I'm brokenhearted about what I see. You see trauma, domestic violence, and I often ask, and I have stopped and asked, and they could not answer me because it's stunned. The question just really, I don't know. What are you mad about? What are you mad about? We're all in this boat together. You're mad. You're trying to be, you're doing for what? Talk to me. What is it that's bothering? And a lot of times they don't know, or they know, but it's so much built in that it's like peeling an onion. You take that first layer off, but even with that first layer, you're making progress, but it's so much that's encompassed and encumbered in just that one layer. I liked the conversation earlier today when you guys were talking about low-hanging fruit. I use that all the time. What could be done in 30 days, 60 days, 90 days, a year? We have to build on those things. So even that 30 days, it might not be much accomplished that you can visibly see, because let's face it, people are looking for data. What changed about this? But sometimes you can't really measure it by graphs or by, data like numbers and percentages. Sometimes you have to look at it like, I made somebody smile today. I made somebody go home and not talk to their kids in such a disrespectful way. And then your kids is outside. I went home today because I told my baby I loved him. So we're dealing with so much trauma here. And it's it's historical trauma. It's trauma every day. People don't see a way out, but we, the clinicians, the social workers, your next door neighbor, the man across the street in the grocery store, hell, me. We have to make you feel good about yourself. How good does it feel for somebody to give you a hug or even say hello or tell you that I love you, you're important, you look good today? It changes it changes everything about what our next step is going to be that day.
That's beautiful. And Miss Marilyn, I don't know if you can see the chat while you've been talking to us, but you just received a standing ovation.
Oh, wow.
If we were all in the room together, we'd all be on our feet. Thank you for the power of your message and for the truth that you're speaking. I would just open to our other panelists, Kimalon, Jodi, Claude, please tell us more about what you're doing and how that intersects with the needs that Ms. Marilyn has just outlined so well.
Sure, I'll just jump in and just start talking about purpose-built communities. Purpose-built communities is a very similar model to choice. It's a comprehensive approach to neighborhood revitalization, really rooted in equity, but moreover, rooted in working with our residents and listening to them. Ms. Marilyn sits on our executive board. We do a lot of listening, and not just listening, but doing. So with purpose-built communities, there's 3 strategic pillars around education, the creation of a high-quality educational pipeline in the neighborhood, mixed income housing with the goal of deconcentrating poverty, and then lastly, wellness, which is really broadly defined by community. It can include an entire gamut of everything from direct access to healthcare, healthy foods, employment, transportation, but really working in a concerted way in a defined neighborhood to implement the strategy. The work is led by a community quarterback who really leads the initiative, secures resources and partnerships. And we are working with Burton Bell Carr, the development corporation for this neighborhood, to position them for that role among their other work that they're doing. And that's really important. As we talk about leveraging resources and coordinating, we need a central organization that can help us to coordinate and determine how we work together and how we can be responsive to those needs that emerge from community in real time. So looking further down the road, it's fantastic that we have this 5-year grant from HUD, but we know to truly achieve transformation and maintain it and also not stay stagnant, we need to have a plan for sustainability. So working with Burton Bell Carr and all of our community partners, we are positioning purpose-built communities as a vehicle for sustainability beyond this 5-year grant term. We know that transformation is probably going to take a little bit longer than that. And we want to make sure that we're nurturing growth as we encourage other partnerships that will continue to propel this neighborhood. And moreover, we want to make sure that our residents are happy. To Ms. Marilyn's point, we want to support healing. We want to help to heal this community from those past wounds that we talked about, historical practices and racism at every level of government, from local policy to federal policy. And it takes a lot of work to undo a lot of the damage. And as I share with people, I think it's really important that we listen to a community that's heard no more than yes, and really work to establish trust as we do everything that we promised to do. It took a lot of work to get this transformation plan together. And a big part of that work was really allowing neighbors to feel comfortable to hope. To Ms. Marilyn's point, there was a lack of hope because they've heard no so many times, so many broken promises. And I think now is our opportunity as a community and as leaders in this community to really deliver on our promises.
Thank you so much, Kimalon. Dr. Jones, we talked, we heard Ms. Marilyn talk about, the trauma that the community has gone through. How can a healthcare provider coming into the community help to address that?
Right. So again, it comes down to building that trust, over a period of time. So the community has developed community ambassadors. Okay, so how can we work with those ambassadors to kind of canvass the community and first of all, find out what the needs are? What are the expectations of the community? What are they looking for? How can we help assist with that? And it's not just that, it's getting the community involved, empowering the community to be a part of their healthcare. So that could mean on a volunteer basis, that could mean hiring job opportunities for the community as well. So this all takes time, to really build and formulate. But I think because of the trauma, we need to have resources in place also that address that. So that's why the behavioral health portion will really be, I believe, will really be effective. This is an absolute game changer. This is something that is, in my estimation, is monumental. And hopefully we'll be able to utilize this model nationwide. So again, it's about building that trust, working with working with the community, getting them involved in everything you do. And I think this trust just builds over a period of time.
Thank you so much. Jodi, the Community Builders is an organization that works in many different communities, not just in our neighborhood. How does your group understand how to meet this neighborhood, this community where they are?
Such a great question. And we would be so unsuccessful if we did not rely and work together with existing residents and community partners like purpose-built communities, for example. We are spread, across several regions, and that's really great. And we can take lessons learned and challenges and know what works and try to implement some things that work in neighborhoods. But we really rely heavily on building relationships locally. And, I think it's really important for us too. We are not a developer that comes in, builds some housing and leaves. But when we go into a neighborhood, we are there for the long haul. So the sustainability work that Kimalon talks about, we'll still be there working together with them well past the choice initiative. We are coming in to stay, and our investment shows that. So I love that you talked to Donald about the sustainability model through the Pathways Hub, because a part of that for us in our community life department is we are grant funded in the work that we do. So we do rely heavily on grants and, working towards those outcomes that we talk about. But I love the idea of the hub model because it does give us some sustainability built into those services that we provide, because we know just because we're coming in this choice grant for a short period of time, the issues don't go away right when the money goes away or runs out. So we work really closely together with those local entities to develop plans that we know will work and are sustainable.
Wonderful. I will make sure that I've asked for folks to ask questions through the chat. We have such a wonderful panel of speakers. Be happy to convey any questions that people have. There were a couple of comments I saw from Dr. Winslow about some work that's being done by the Robert Wood Johnson Foundation to create a culture of health in our communities. And he also shared a great quote: "All change moves at the speed of trust." And I think that that really echoes what a lot of our panelists have been saying. I would love to hear from any of you, just an example. What does success look like? I respect Miss Marilyn's comment that we can't ask the question, what are we doing in 5 years? Because we haven't answered the question, what are we doing today and tomorrow? But for all of us in our roles in the efforts in this community, tell me something that will let you know that you are on the path, that there is success there.
Well, I'll just start with purpose-built communities being so similar to the choice model. Really, the value that this model brings is around the focus on education. So if you look at the Woodhill Homes Needs Assessment, we learned that only 8% of the children who are entering kindergarten are kindergarten ready. For us, that means partnering with our high quality early learning providers in the neighborhood to really enhance accessibility to high quality early learning. There will be a new early learning center built on campus, also working with parents around understanding the necessity of high quality early learning, and then also really enhancing their opportunities for other early learning opportunities in the neighborhood. So for me, one big area of success would be increasing those in kindergarten readiness rates. And we know that it's also an indicator of later academic success in later life. The other piece for me is working with CMSD, who is our educational partner. I'm really proud that they are looking at how do we best take advantage of all the innovative practices they've done and build on that with a foundation to really enhance education. We also learned from the needs assessment that our kids in this neighborhood go to more than 60 schools throughout the city. And we're talking about people who face transportation challenges, employment challenges. So for me, I'm also about, I always share that when you're poor, it's difficult and it's expensive. So we can make high quality choice accessible in the neighborhood to make life easier and better for the people who live, work, and play there. To me, that's the biggest area of success. And then lastly, my other measure of success is just doing what we say we would do. I want to say that we activated that Woodhill transformation plan and added on to it. I don't want to be the continuary, that's such a word, of broken promises. So for me, I'm looking at the educational component and making sure that we do everything else, plus then some, that are included in the Woodhill transformation plan.
And that gets right to the heart of the trust issue, which we've all been talking about. Others on the panel, measures of success.
All right, so I think right away, and I'm sorry, go ahead. Go ahead, Jodi.
I'll be very brief. We have a lot of outcomes that we are held to hit when it comes to this plan, right? You can imagine with $35 million being invested in a neighborhood, we have to do a lot of work in all of these areas. But when I think about 10 years from now and looking back at the work we did, I think the number one indicator of success for me is, did we leverage our skills, our organizational capacity, our privilege, and whatever that looks like, to really just uplift the residents' voice and build capacity for them so that they can carry forward the vision that they created without us? That would be the gold standard, I think, for me, is that we uplift Miss Marilyn's voice and the rest of her neighbors to really do what they want to do and give them all, help them partner together to bring a powerful voice to make that a reality.
Terrific. Dr. Jones.
Yes, thank you for that. So I want to go back a little bit to what Kimalon said. And so K through 12 education, that's just so important, making sure we have good education on that level, but it's also the health education as well, making sure we stay in front of the community. We're educating them on disease states. We know during the needs assessment that chronic disease is rampant, especially in that area. So how can we help stamp that out? COVID education as well. We're working with RTA. They've actually converted one of their buses into a vaccination unit, and we're over at Woodhill about every 2 weeks with that bus, just making sure we get that information and also important vaccination information over to the community. Jobs, workforce, creating internships if possible, hopefully bringing in members of the community to be a part of that, and also health outcomes just overall. Now, we may have to look retrospectively at some point, maybe 5-10 years down the road, to see if we really made a difference. Again, focusing on those chronic disease states, not just diabetes, hypertension, HIV, things like that. And also the real big one that we tend to forget about is the opiate epidemic as well, that's really been ravaging our communities. So I think those overall, who's utilizing the services, how much over a period of time, and are we really taking a look at those social determinants of health, transportation, food, things like that. A part of this will be a food pantry. I'm working real closely with the food banks. So there's a myriad of outcomes we can take a look at, but those are some of the big ones.
Thank you for all of those ideas. Ms. Marilyn, please, I want to hear from you. Yes, go ahead.
I think food of the spirit. My God, what a perfect note to end on. And we often ask sometimes, what is the food of the spirit? Respect, love, kindness. All these things help to change the trajectory of what we do and how we treat each other on a day-to-day basis. I often tell people I'm not a religious fanatic, but I am very much spiritual. And I often think about the beginning of the book. What is God? He is love. He is spirit. It's nothing that you see, but it is definitely something that you can feel. And when we start with these things, our light, we have to bring back to the community. I would like to just drive down the street one day and see this bright light around this whole community. And people say, what is that? That's Woodhill. That's Woodhill's light shining because of all the things that have been said here today to move the needle forward in a more positive direction. What better way to let a light shine throughout a community? Shine with sincerity, shine with hope, shine with love, shine with empowerment, encouragement, It's such a powerful thing. All these things that we can bring to the table, and that piece of efficacy that I have not heard that word in the conversation today. But what is that power, that support that's going to move all these things to a place where we can look at equity and say, yes, we've all been served with the fruit of the Spirit of all the things that have been brought to the table today. Thank you.
Beautiful. There's a question from the chat from Angela Campitelli. Does this effort include helping residents create their own small business, not just jobs working for others? That's so important because, their efforts across the city to improve the utilization of minority-owned businesses. Cleveland Clinic Health Community Health Outreach is focusing on heal, hire, and invest. Contract with, buy from minority-owned businesses. Tell to any of you, Kimalon, because I know you answered this in the chat before, or anybody else who has any input, tell us how do we start the spirit of entrepreneurship?
Actually, I can't say we started, we nurture it. It's already there. There are people who aspire to work for themselves. And I think that's a part of wealth building and really a part of power sharing. So we do have partnerships in place with a number of our workforce providers and also small business development organizations that are going to help nurture and help support residents who want to move down that path towards entrepreneurship. And I think it's a great thing, especially because we know that there might be some residents who don't necessarily fit in the box of traditional employment, nor do they want to. And I think that's fine. So definitely want to include that as a focus in our workforce development strategies already in there.
Being part of the community and being out here every day. I just had this conversation with the gentleman yesterday. There are people that, let's face it, just do not want to go to college, but they want to know a trade. I know a lot of young men. I'm working with 2 gentlemen right now about showing young people starting at school age, say from the 9th grade all the way through, and getting an apprenticeship after the training to some college credits or whatever, that want to become builders or construction workers. Even some young women, I want to do that. I want to go to college, but I want to know a trade. And like, I'm working with these gentlemen, trying to get this trying to connect them with the right people to talk to as well, so we can get this off the board. Isn't it? And even women, so several years ago, I had a contracting company, and people were saying, and it was me and this other older gentleman that started it. And I often heard people say, what are these 2 old people going to do? But I built porch decks, basements. I've been up on roofs. Oh, yeah. And it's wonderful for women to say, punch their boyfriend or punch their husband in a conversation, say, look at that woman. If she could do it, why can't I? So women, we want to introduce this to women as well. Young people who don't think about going to college. These things are important because, it gives them a sense of pride. I know that it did for me, being able to build something out of nothing. And that's what we want to do. Just hands-on work such as that, and building up the spirit. I have to keep going back to that. And in order for these things to come into fruition, to become possible, we have to change the way we feel inside and the way we treat each other, to encourage and empower each other to say, hey, if we can do this, we can do this. I love you, you love me. Let's come together. Let's work on this collaboratively. Let's bring people of like-minded that are trying to do this together. And oh my God, what an awesome thing it is to start with one match, light another one, and then another one. Can you imagine what kind of light that would bring into our communities?
Terrific. Another question from the chat was about kind of the structure of the whole project, asking what organization is the lead. Kimalon, you were describing in your answer a little bit. Can you talk about the larger project, sort of the structure and who the partners are and so forth?
Sure, and I'm also going to invite my colleagues in case I missed something, because there's so many moving pieces and parts. The City of Cleveland, the Cuyahoga Metropolitan Housing Authority, received the $35 million HUD Choice Neighborhood Implementation Grant. And I also think it's important to note that there was a 2-year planning process that preceded the actual implementation grant. And the 2-year planning process came with a grant and allowed us to do really robust community engagement to understand what the community wanted to see, to understand the needs in the community, and really evolve into this Woodhill transformation plan. So we have the community builders who are leading the people part of this holistic strategy. And the people part deals with social and support services, like Jodi talked about, the case management, community life. It also deals with education, health, employment, entrepreneurship, transportation. I equate it to those social determinants of health factors that we know impact the quality of life. Then we have a housing component, and the community builders, I do believe, yes, Jodi's nodding, are also leading that part of the strategy as well. The housing component is this built environment, the green spaces, the actual construction of the soon to be redeveloped Woodhill homes, which will be a combined mixture of multifamily apartments, townhomes that will replace the 487 units, but also lead to actually 800 planned units. So we have more units that we're going to have than we started with. And then the last part of the strategy is around neighborhood. And neighborhood is everything in between from, and I'm going to ask Jodi to help me because I always get confused between housing and neighborhood. But neighborhood is being led by city architecture, Jodi?
Yes, I think that's safe to say.
Okay. And we're also talking about the other amenities, green spaces, public spaces, looking at the topography of how the neighborhood is situated to really be conducive. Right now, as I understand, it's built on a slant. Oh, CMHA, thank you, Monique. My colleague, Monique Williams from the engagement group, just texted me and said that the city of Cleveland is leading the neighborhood strategy. So once again, as you can see, we lean on each other and depend on each other as we move this train forward. But that's really the structure. We have these organizations that are leading those particular strategies, but we have a slew of partners that are working to activate those strategies. And through all of that, we have our residents who we are listening to and helping us to guide our efforts and set the priorities for this work, in addition to complying with HUD. I have to put that in as well.
Wonderful.
I would just
go ahead, Jodi.
I'll quickly add to what Kimalon said. I want to uplift exactly what you said about the housing. The fact that we are bringing 800 new mixed income units to the neighborhood, which is the most, I believe, of any other choice grant from 2010 to now, which is a really huge investment. And I know when I talk to some of our other health partners, whether in a hub model or something similar in other cities, the number one issue that they find when they're trying to support residents is to actually find safe, healthy, affordable housing. And I think the real opportunity we have here in this project is to leverage that all of these residents ideally will have safe, healthy, affordable housing. And we can really use that as a platform to really go further with a lot of these other areas where housing is sometimes a real barrier, because if you don't have safe, healthy, affordable housing, we can't really talk about getting your child into preschool, right? A lot of what Miss Marilyn said, we have to start with the basics. We have to meet people where they are, and housing is so critical. I know all of you on this call understand that. So we have a really exemplary opportunity with that piece. The other thing I wanted to highlight when we talk about jobs and workforce development is that with HUD, we have real goals where it comes to hiring from the neighborhood, when it comes to the construction of these new units, demolition and building new. We have real goals around hiring women, hiring minority businesses, and that's a real central piece of this work too. So not only supporting people through entrepreneur paths and workforce programs, but hiring within the community for the work that we are doing in the community.
So I was just going to ask if there's a website that people can go to find out more about this project, see if they can contribute. As I think of that question, I also think there is also a large segment of the community that doesn't have digital access. And I know that that's a part of the plan as well. Where can we go to find out more, and how is the digital divide going to be addressed?
Well, there's a really robust partnership with Digital C, who are installing towers in the meanwhile, installing towers in the CMHA campus to provide access in the short term. But long term, there is definitely a plan to make sure that everyone in Woodhill homes will have access to digital connectivity that's being wired in. We're talking about innovative state-of-the-art housing that will have those amenities that some of us take for granted. I saw a really great question in the chat that talks about the structure, and I meant to talk about this in terms of how we are working together. We have a governance structure being led by a steering committee. Steering committee is made up of residents, it's made of community stakeholders, and those leads that we talked about, the community builders, purpose-built communities, and CMHA all working together to ensure that we are complying with HUD guidelines, but also listening to and being true to this Woodhill transformation plan. We also have transformation team working at the neighborhood level, coordinating all the partners. And that's once again also comprised with residents and community stakeholders and project partners who are working together to implement this plan. And then lastly, we have this body of individuals who will be helping to connect with other influencers and other resources to really make up this Woodhill Transformation Coalition is what we're calling it. So for more information, there will be information on the CMHA website. There's some there already. There is some, we'll share some links at the end of this presentation to really be able to learn more. And I do believe the community builders will be also having information in one consolidated place to really share about the project, progress of the project as we move forward.
Beautiful. And Jodi just did enter a link into the chat. So please refer there, and we'll share any information that we have. We're up against time with just about a minute left. I'm going to say, Ms. Marilyn, would you please close us out?
My goodness, this has just been so overwhelming to me today. I often tell people I've seen a little bit of the accolades, and I thank you very much for me. But I must say that these words were put upon my heart by someone who's much higher than all of us. I often talk to my father. He's been talking to me all through this conversation, giving me the right words to say, giving me the right spirit to touch his people, and we are his people. And I'm just a vessel. I'm not very important. I'm just a vessel, but I'm humbled to be used by somebody who cared that much about me and to put me in a position here to speak to you all today from the heart, from the spirit. And it's just so humbling to me to be able to touch the hearts and minds of people who are in power, who can take the words that I have expressed to you guys today and make them work, give you some food for thought, give you food for the spirit. And I just hope that everything that we have talked about today and will truly sink in and truly motivate you to reach out to your brother or sister, no matter what position in life they are in. Thank you.
Thank you so much, and thank you to all of our panelists and to the those in the audience who are contributing great questions and